My name is Elsa Gonzalez. I am 68 years old. I was diagnosed with pancreatic cancer, stage 1, in February 2023. I ended up setting up an appointment with my primary care physician because I wasn't feeling well. I felt I had eaten something that wasn't agreeing with me. I realized once that happened that they noticed my skin color. My skin color was yellow. So I went to urgent care, and the doctor, as soon as he saw me, he said, "Something is very wrong and you need to go to the emergency room right now because I don't have the equipment to test whatever's going on with you." We went to the emergency room here in St. John's, and I was escorted to one of the rooms where the nurse said, "Please get comfortable because you will be spending the night." I just kept getting surprised because I had no idea how serious the situation was. So my son went home to get me items so that I could spend the night. But while he was gone, the emergency care doctor scheduled a CT scan. So once it was over, he came into the room and was looking at the computer screen, and I lightheartedly said, "What's going on, doctor?" He hesitated, and then he said, "I think it's cancer." I didn't know what to say. I was just stunned. He says, "We need to get on this right away, and you have to have this looked at and taken care of by next week." On that Tuesday, a few days after, I saw Dr. Sewell, who is a gastroenterologist. He was very kind to me and explained what he was going to do. He was going to put a stent in and also take a biopsy. At that time, I was with a friend of mine because her husband had passed away from pancreatic cancer the year before. When I advised her what was happening with me, she asked me to please let her walk this journey with her because she thought it would be therapeutic for her. I realized how difficult it would be, and I told her if it would be too much, you're going to have to step back and it's okay. I would understand. And she said the reason she could walk the journey with me because her husband was at UCLA. She said, had I been to UCLA, she would have not been able probably to do that because it would have been too close for her. But she did tell me, because she went with me to all the appointments, how wonderful my doctors were. She goes, "It was not the same when I was going to UCLA." She goes, "Your doctors were very informative. They told you, and I would always go with questions." A couple of days later, I was in the surgery having this procedure with Dr. Sewell. And a couple of days after that, he called me to give me the results. They were inconclusive at the time. So he was able to put the stent in, but they didn't know. So I saw Dr. Fischer. The stars were aligned because he wasn't supposed to be there. He was supposed to be on jury duty, but something happened that fell through, so he was able to see me. He was also very kind and very patient and explained to me what would happen after the surgery, but that he was gonna schedule a CT and a PET scan to see how large the tumor would be, because depending on the size, they might have to do chemotherapy first to shrink it and then have surgery. And then a few days after that, I saw Bilchik, and he also was just great. He's just so warm and so comforting. Just his demeanor just made me feel very comfortable and at ease. So he explained to me what they were going to do, the Whipple procedure, and then he gave me a little picture of what they were going to do and what they were going to, have to take out and, reattach. And so he explained that to me, and then his staff gave me all the instructions I would need for the surgery, for the Whipple procedure, because it is quite a bit of instructions and work that you have to do before the surgery. Everything happened very fast. And I never thought about what the next step would be. I would just wait for the doctors to tell me and go from there. I never did a lot of what ifs and start thinking on my own. And I did do what Dr. Bilchik said. Do not Google anything, because that doesn't tell you about your story. So I didn't, and I was glad I didn't. On March 22nd, 2023, I had the surgery, the Whipple procedure. I was in the hospital for 4 days. And they treated me wonderfully. All the nurses were great to me. Dr. Bilchik came to see me every day. Dr. Fischer came to see me the next day to tell me he would be seeing me the following month to start my chemotherapy. I was in distress. It's very difficult after you have that kind of surgery. But I called the next day, and the staff did help me out and prescribe more medication to help me, because I was just feeling my stomach was not feeling good. About that following week, I went to see Dr. Bilchik. And of course, he was his same warm, comforting self. And he explained to me that the surgery had gone well, and they even had to not do anything with my stomach, because normally they have to cut into your stomach. That's part of the surgery, based on where the tumor is. But based on my situation, I did not have to have the stomach touched, and that's very helpful. He said maybe now it's not, but later in the long term, it is very helpful. A few weeks after that, I met with Dr. Fischer again to talk about chemotherapy. This type of cancer tends to come back, so we're going to do preventative chemotherapy. So we're going to do it every 2 weeks. You'll come in, you'll have a treatment here for 3.5 hours. Then you're going to have a pump inserted that you're going to take home for 2 days. And then once that's all gone, then you'll come back and turn in the pump. So we're going to do this for 6 months. So it's 2 days on, 12 days off. That's how he explained the process. But he was very, very comforting, because he took my hand and said, "You are not alone. We're going to walk this journey with you." And it was just, I just can't express how much that meant to me. And I didn't have too much reaction to it. My reaction was, I would get cramps in my stomach when it would start to end the chemotherapy. And then they started to give me medication prior to me leaving to alleviate that. But I was very fortunate that I never had any of the nausea, the vomiting. I never had a lot of the effects. But I have to say, they prepare you for all of that. They give you all the medications you're going to need, so that if you do have those symptoms, you have what you need to take to make them go away. So that was very helpful. They finished in October, and in November, the end of November, Dr. Fischer told me that I was cancer-free and in remission, that I had no restrictions. I was thrilled. I didn't know what to say. That I would see him every 2 months. I would have a CT scan every 3 months just to make sure that everything stayed the same. But he cautioned me to be aware that the next 18 months would be very important, as that is when the cancer returns. I asked him, where does it return from? And that's when he told me, he said the liver. There's something that comes back from the liver. So every time I see him, he does blood work, but there's a specific test he does that is called the Signatera. And that's a more sensitive blood test, because it will detect cancer in your cells. And that's what he wants to see. My last 3 CT scans have been clean, what I call clean. And right now I'm still cancer-free and in remission. I feel great. I'm starting to really get back into working out, which I did before this all started. I did a hike of 6 miles a couple of weeks ago and feel great about that. And life is good, but I owe it all to my doctors at St. John's, my medical care team. I could never have imagined they would have been so great to me. And they just all care. They just make you feel that they're there for you. And I can't express enough my great gratitude to all of them. And that's my story. I never went with the what ifs. I never got ahead of myself. I always listened to the doctor, and based on what he said, just took it step by step. I never went more than that, because it just didn't help any, and I think it just creates more anxiety. And you may never get there. That might never happen to you, so you did all that for nothing. You really need to save your energy for what you need to focus on, which is just getting better and listening to the doctor. So to me, that was my way to operate this whole journey. They did a genetic testing on me, and they said that I don't have it in my genes, which was good news to me, because that means I can't pass it on to my son. He could still get it, and I get that, but he won't get it from me. So had it not been for me feeling the way I was feeling, I would have never known. And my skin tone, of course. I will say that a friend of mine, he's like my brother. He has a friend who's a nurse, and I was going to ask him, and I didn't ask him. She works at a hospital. She is way east from here. I want to, like West Covina. She lives far east. And she had told him, tell her when she goes, she should see Dr. Bilchik, because he's the specialist. And I said, that is who I'm getting. And it was surprising to me that someone of that notoriety would be seeing patients like me. I really was surprised and of course pleased, but I have heard that because of, that's not the case always at other hospitals, I'll say that. I'm one of those people that I'm very proactive in my healthcare. So I check the results every time. I was comparing, all the items that I could be responsible for. I would check my calcium, my protein, my glucose, all those items that I could work on, I checked every time I got a test, because if my calcium's low, I need to do that, right? For many years, I've taken care of my body, and now my body's taking care of me. Dr. Bilchik, I want to thank you. I consider that you saved my life. You truly made this experience better for me because you were so comforting, and your soft demeanor was very helpful to me, and I thank you from the bottom of my heart for all you did for me. I'm grateful to you forever. Dr. Sean Fischer, we're still on this journey. We're not done. You're my partner in crime right now, and I'm so grateful to you because you are very warm and kind and have been very responsive to all my inquiries to you, and I owe you my life. And we're not done. We're still going down this journey, but I appreciate you for everything that you have done.